When someone first gets a diagnosis of cancer, they're not really hearing anything after the point where they realize, I have cancer. That's when this sort of strange reality starts to sink in that something very different and dramatic is about to happen to them, and they are facing a potentially life-threatening situation. So what we try to do with music therapy is help those people who have gone to really clinical levels of anxiety, clinical levels of depression, and help to bring that back down.
I'm passionate about music. I am humbled that daily I get to utilize music and see the positive effect that it can have with patients and their families as well.
So when music therapy comes in, Ryan will sit there and look at someone and say, what do you like to listen to? And it's incredibly individually tailored to that person.
On the surface level, music can be a positive distraction with someone, let's say, who has cancer. Research now supports that the direct connection between music and that listening experience and how our bodies physiologically will react and respond to it, many times especially on an emotional level.
So someone chooses a song, and normally people choose meaningful songs, songs that give them hope or inspire them or bring back really happy memories. And what we can start to do with music therapy is process what that experience is like, hearing that in the hospital, here, right now for them. And it's a vehicle to help them understand that life may change, but it still continues. That cancer doesn't define who they are. Who they are is a person that loves music, that has memories, that maybe can sing and dance and experience joy no matter what the circumstance.
I think a lot of time with patients and the amount of medications that they're on, the chemotherapy, the oral pills, the IV meds, quite frankly, they get tired of those things.
I always like to share that I'm a scientist practitioner and I look for evidence-based programs and I bring them to the hospital because I know they're going to help our patients. But I don't think those words really capture the magic that happens.
Music and the music therapy interventions I've found can be just as effective for certain symptom management and side effects of treatment than a pill can.
Well, it's been great, you know, it makes me feel good. I'm a musician myself. So everything, you know, is blocked out and I'm just, you know, in the moment of the music and, you know, I forget about what's going on with me or any problems that I might be thinking of. It always comforts me.
When you see a patient listen to the music being created just for them in their room and you watch the spark, and suddenly here in this hospital where they never anticipated that they would find something within themselves that they didn't even know existed, there's something so very special that happens here. I am so proud to be a part of this program and to be able to lead an amazing team as we help patients deal and cope with this very stressful time in their lives.
Bryce, first, thank you for your generosity. Thank you for seeing a need and for acting on that. You have equipped me to work here with patients that I will never forget. These are all for me on a personal level, making me a better person. They're making me a better clinician. And these are experiences that I cannot put a price tag on. And so thank you for allowing me to be here.